The most helpful skill ultrasound provides me when doing procedures is the ability to follow my needle tip, so I can be safe, efficient, and precise when inserting a needle into a vessel. If you're not familiar or not confident in your ability to follow your needle tip, then this video is for you. I'm Dr. Alex Estelle, and this is SonoCare. Ultrasound lets us do two things when it comes to inserting needles into veins and arteries. The first is that it allows us to find vessels that may not be readily apparent by looking or feeling. Frequently, otherwise invisible vessels pop out when we use ultrasound. The other thing it allows us to do is follow our needle tip in real time to ensure we know where the tip is. The advantage of doing this is that it helps to minimize complications, as the tip is the part of the needle that has the potential to damage other structures. It also allows for faster procedures, as you can be very precise with your movements and optimize your success for entering the vessel in your first attempt. I'm not going to talk about the particulars of any specific procedure, as there are some differences between inserting peripheral IVs, arterial lines, and central lines. From an ultrasound perspective, however, the approach is the same to getting your needle into the vessel. You start by identifying the vessel you want to insert a cannula into. Then you follow the vessel approximately to ensure it is patent and you know which direction it's heading. Once you've chosen your insertion site, you'll want to clean the area in the usual way and drape the ultrasound probe with a sterile cover if appropriate. Once you've landmarked the vessel in the center of your screen, you insert your needle a couple of millimeters under the skin until you're able to see the tip. The tip should be a bright, shiny structure seen in the center of your field if you've lined yourself up properly. Here, my alignment was slightly to the left of the vessel, but because I was able to see my needle tip, I was able to adjust my approach to the right, directing the needle into the vessel. Following your needle tip involves a series of sequential movements, advancing your probe until you cannot see your needle tip anymore, and then advancing your needle until the tip becomes visible again. In this way, our field of view is always ahead of the needle, so we know where we're going. If we're not viewing the tip of the needle, then the tip has gone beyond our field of view and we have no idea where our tip is. This is where we can get into trouble with damaging other structures. We should be able to continue the sequence of advancing the probe and then advancing the needle until we can watch our needle enter the vessel of interest. I will often continue to advance the needle along the vessel a little bit to ensure that my catheter threads nicely into the lumen of the vessel. Depending on the procedure, I'll also check for blood return as another sign that I'm in the right place. It's not uncommon that you lose track of your needle or can only find the shaft but can't find the tip. When this happens, I try one of two things. Firstly, I bring the probe back to where I inserted the needle under the skin, find the shaft, and then follow the needle approximately until I lose it. I then advance the needle slowly, and if I'm able to see the tip, I continue to do the procedure as planned. If I can't find the tip or I'm unsure if I found the tip, I bring the needle back into the last place that I was confident I saw it and try and find it under ultrasound. If that's unsuccessful, I bring the needle all the way back to the area just under the skin where we started, find it again with ultrasound, and then I begin to restart advancing the needle. Learning to follow your needle tip takes some practice. There are many medical grade simulators that allow for this practice, but my favorite hack is to take a block of tofu, core out a piece with a straw, and place the tofu in a dish of water such that it's nearly entirely submerged. The tofu acts as a great propagator of ultrasound waves, and the missing area, now filled with water, has the appearance of a vessel. You can then take a needle and practice inserting your needle into the vessel you've created. To recap, using ultrasound for vascular access allows us to follow our needle tip so we can be safe and precise with our movements. It takes a little practice for these movements to feel comfortable, but I found that once I had it down, I was faster with my procedures, even when you count the time taken to set up the ultrasound machine. I hope you found this video helpful. Now get out there and scan.